The Irish housing crisis and health. Inequalities in housing can cause major health disparities. Additionally, not all housing is created equally. While it may seem that if you have a house, you're okay, a lot of housing has poor facilities, can have factors such as leaky roofs, bad heating, or just generally unsanitary conditions. Homelessness increases the risk of contracting both infectious diseases and non-infectious diseases, according to the CDC. Homelessness has been on the rise in Ireland, and it's a growing issue that needs to be addressed at the policy level as well as at the community level. According to the European Commission, homelessness is one of the most extreme forms of social exclusion, negatively affecting people's physical and mental health, well-being and life expectancy, as well as their access to employment and access to other economic and social services. Multiple issues contribute to inequalities in housing, and these issues can compound. The Irish cost of living is approximately 36% above the EU average, according to Eurostat 2026. This makes getting affordable housing extremely difficult for our citizens and increases the amount of homeless people each year. High cost of living, inadequate housing levels, lack of emergency housing, rising rents, and discrimination all contribute to social inequalities in housing. In Ireland, there is currently a lack of houses, a lack of social houses, and it's extremely difficult to find emergency accommodation for those that are homeless. These issues mean that people in need do not get the help that they need in order to be out of their position and get the help they need in terms of finding resources to aid in their health issues, in order to get off the street, and in order to increase their financial power and hopefully find safe and secure housing. Homelessness is known to increase the risk for infectious diseases such as viral hepatitis, tuberculosis, HIV, and COVID. These are very serious illnesses, and homelessness contributes severely to all of these. In order to manage our health outcomes, we need to manage the causes that are contributing to these health outcomes. And with homelessness being such a major contributor to a wide variety of diseases, it is of utmost importance that policy change and community resources are implemented in order to aid people in need. Homelessness can also contribute to other health risks, such as anxiety and depression, and access to healthcare issues. Those who are homeless are generally struggling financially, and when households cannot afford the housing that they need, it also generally means that they cannot afford healthcare in Ireland. This means that preventative treatments do not get done. It means that irregular checkups do not get done, and infections and diseases that could be prevented are going unnoticed until it's too late. The first solution is to increase affordable and safe housing. 25% of the population in Ireland experience housing deprivation, meaning that the resources and the facilities in their housing is not appropriate for their standard of living. Government schemes for home improvement and prioritisation of maintenance of social housing is needed in order to mitigate the risks to health. Additionally, government policy for mitigating rent spikes and aiding individuals in acquiring secure and safe permanent housing is needed in Ireland. Those who can get emergency accommodation often are not able to stay there long term, and even if social housing is provided, it's often not to a reasonable standard, meaning that people are put in social housing, forgotten about, and they are still facing major health risks. The second solution is to improve healthcare access for vulnerable renters and homeless people. Cost-burdened households have little left over each month to spend on other necessities such as food, clothing, utilities, and healthcare, according to the Office of Disease Prevention and Health Promotion. Increasing social welfare benefits for disadvantaged people, such as immigrants and those with disabilities, would ease the cost burden relating to accessing healthcare. Increasing access to government schemes such as medical and GP cards would allow those under financial stress to access healthcare with ease. While GP and medical cards are generally easily accessible, they are often still not handed out to those who truly need them. And increasing the amount of people that could get these, especially considering the broader free healthcare schemes in Ireland, would greatly improve health outcomes nationwide. In conclusion, housing inequality is a major social determinant of health in Ireland. By improving access to affordable housing and healthcare, health disparities, especially amongst those who are vulnerable, can be greatly reduced.